Hello everyone. In this video, you will learn about skin substitute grafts. In the last class, you have learned about the autografts. Today, you will learn about the skin substitute grafts. So, skin substitute grafts, these are the temporary grafts. So, whenever the patient's own skin is not available, physician will opt for the skin substitute graft. So, these are actually temporary. So he is covering the patient's wound temporarily when the wound skin is not available. Okay. So it is applied over a prepared wound bed and secured in place. So it will provide protection against the infection and it will also reduce the fluid loss. It will also decrease the pain and it will support the healing of the underlying tissues. So we have the types of skin substitute grafts. So allograft, this is from the human donor. Okay. Xenografts, this is from the animal source. Then we have a cellular dermal matrix. Next we have tissue engineered or bioengineered skin. So these are the allografts you can find in the OP report whenever the physician is opting for the skin substitute grafts. Okay. Next, we have CPT codes 15271 and 15272 for the trunk arm legs. So these CPTs you need to code only the for the small area that is less than 100 square centimeters. Okay. Till 99 square centimeters you can use 15271 and 272. Okay. So first you have to know the procedure what the physician is doing. So whether he is applying the skin substitute or not for the temporary wound closure. Okay. Next you have to check for the body area whether the patient is using the skin substitute graft on the trunk, arms or legs. Okay. To select this set of CPT codes. Okay. Next, what is the purpose? Temporary closure. Okay, for temporary closure only you have to code skin substitute grafts or else you will not be coding skin substitute grafts. So they will protect from the infection and fluid loss and they will reduce the pain and they will promote the healing until the permanent graft is applied. Okay, so you have to check for the types of grafts used. Okay, so we have acellular dermal replacement, okay, allograft, xenograft, and tissue culture skin substitute. So already I discussed these are the skin substitute grafts. Okay, so these are allografts. Okay, next we have procedure steps. Okay, so whenever the wound bread is prepared, he will place a skin substitute. These are the skin substitute. He is going to shape it and fit onto the wound. Okay, and suture it or staple it. Okay, so here size will matter. So we will code up to 99 square centimeters. You can code this CPT for trunk, arm, and legs. So we have to code 15271 for first 25 square centimeters or less. 15272 for each additional 25 square centimeters or less. For example, if the physician is doing the applying the skin substitute grafts on the, let's say, legs 50 square centimeters, then you will code CPT 15271 and 15272. Two CPT codes you need to code. Next, you have CPT code 15273 and 274. So these are the four. So these are for the large area and that too for the greater than 100 square centimeters. So or equal to 100 square centimeters. So 199 square centimeters you have to use 272 and 273. 271 and 272. For greater than or equal to 100 square centimeters, you need to use 273 and 274. Okay. So the procedure here is same for skin substitute graft, but the size matters. Okay, wound area. So here for 100 square centimeters and greater than, you can use this CPT codes, large area CPT codes. So we have a special rule for the children. So for children, if it is like patient's age is 10 or greater than 10, then you have to use square centimeter. So if patient's age is less than 10 years, you have to use the percentage of the body surface area. Okay, this is the thing for the children. Okay, you have to check for the children less than 10 years, you need to calculate based on the body surface area. So for first 100 square centimeters or 1% total body surface area, this you will follow for the less than 10 years. Okay, so you will report 273 and 274 for first 100 square centimeters and each additional 100 square centimeters. Okay, that's the thing. If if an infant of like 5 years old, he is having the like applied a skin, physician has applied skin substitute graft 2% total body surface area, then you will report 15273 and 274. So 2% 1%, and each additional 1% you can call 273 and 274. Okay. Then you have CPT 15275 and 276 for face, scalp, hands, feet. Okay, for small area that is less than 100 square centimeter. So procedure here is same. You have to check for the body area, whether it is face, scalp, eyelids, mouth, neck, ears, orbits, genitalia, hands, feet, multiple digits. Okay, purpose is also same. Procedure steps also same. Okay, so here like for small area, right? Like for until 99 square centimeters, you can use this CPT codes 275 and 276 25. For first 25, you can use 275. For each additional 25, you can use 276. Next, we have CPT 277 and 278 for the large in area, that is 100 square centimeters and greater. So the procedure is here also same. Okay. So same as above, face, scalp, hands, and everything, whatever we discussed. So this is for the greater than 100 square centimeters or equal to. Okay. So age rule here also same. So you have to check. Okay. For infants, you will calculate based on the total body surface area. If it is greater than 10 years, you will follow square centimeters. So 277 for first 100 square centimeters and 278 for each additional 100 square centimeters. Okay. Hope you understood the skin substitute grafts very well, and see you in the next integumentary system video. Please like and subscribe if you feel the content is very good. If you are interested in surgery coding, you can contact me through the mail, which I will be sharing in the description. Thank you. Happy coding.